Right. Good morning, everyone. Happy Friday. Today is Friday, February 24th. Welcome to Coffee with Community Services. John Decker, our usual host, is attending a conference this Friday, so he will not be present. He will be back next week. I know my box says his name. We had to use his login for this account. So my name is Jordan Eller, though. I'll do a few introductions of both case management staff and some community services staff that I see present with us this morning. We have Scott Barr. Good morning, Scott. I see Ms. Isabella Vega. Good morning, Isabel. I see Jason Scantleberry. He will be talking with us today about coordinated family services. I also see Carly on, our employment specialist. She'll be consulting with us today about some new training resources and also some updates on the VMRC and ACRC collaborative work group. Let's see, from community services, Miss Helen Neary, community services manager. Good morning, Helen. We also have Michelle on, community services manager. Good morning, Michelle. And I see Miss Shirley. Good morning, Shirley, and Odelia. Good morning, Odelia. Let's see, any more community services staff on here? I think so. And I see Christy Iwasa, our transition specialist. Good morning, Christy. And then in regards to case management staff, we have Michelle Johnson, our Director of Client Services. I also see Dana, Adult Client Services Manager, Laura Gorham, Adult Client Services Manager. We have Miss Kanisha Hurd. Good morning. And Veronica Hallgren from our Woodland office. Good morning. I see that Gary has joined us. Good morning, Gary, and Danny. Good morning. And let's see. So we'll go ahead and get started. I will kick it off to Miss Helen. She is going to consult with us this morning about some transportation updates and transportation service requests.
Hello, good morning. I will be giving an update on the processing of the transportation service requests. As of yesterday at 4 o'clock in the afternoon, we have a total of 262 new TSRs. That means that new TSRs that have not been processed, 262 of them. Now the transportation coordinators, Tanya, her split is from A to F. She has about 35 pending TSRs. That means that these TSRs are waiting for vendors to respond. She has already contacted some of the vendors, see if they're willing to take the clients, and she's waiting for them to respond to her. That's 35 for Tanya. And Tanya is processing TSRs from February 1st till February 15th. So that is a good progress that they're making. So any SCs that are in here, please check in Sandus to see the status of the TSRs. But Tanya is processing February 1st to the 15th. Ka, unfortunately, is out for bereavement leave. So she's out for the whole week this week. Marty, her split is Q to Z, and Marty is processing from January 17th till February 10th. And Marty has 14 TSRs that are processed. That means they're confirmed. 11 that's in planning. She's waiting for the vendors to get back to her. She has 15 that were rejected. So that means that she would have to start over with the process of looking for a vendor for these 15 that were rejected. And she has 22 that's still to be processed. And I wanted to remind, if there are any transportation vendors here that signed up for the monthly rate and you have not confirmed, please go ahead and contact me and give me your confirmation so we can put the rate on the rate table. Right now, out of the 4 that signed up for transportation monthly rate, we only have 2 that confirm. So basically the other two needs to let me know that you guys are, proceeding with the monthly rates. And then the other update that I have, I don't know if there are early start providers in this group. We have a grant for over $200,000 to train your staff on specific topics that that is set by DDS. And if there are, I'm not sure if there are early start providers here, but please go ahead and contact me so I can give you the documentation for the training grant. That's all I have, Jordan.
Okay, perfect. Does anybody have any questions for Helen regarding either transportation or the EI training grants? No? Okay. Okay. I know transportation is always a hot topic, so I want to make sure you guys have an opportunity to ask questions if you haven't. Next, we'll go ahead and get our standard weekly HCBS update from our HCBS specialist, Miss Alicia.
Hi, good morning. Sorry I'm so backlit. The snow outside is bouncing off the back of my head. We just got our newest update from DDS. We get daily updates from them, and they have put us in the 82% compliance rate, which is great. We're jumping up quickly. We still have 78 vendor codes that are not HCBS compliance right now, but we have 3 weeks to get that done. 5 providers have still not reached out and submitted any documentation. We are looking for all documentation to be submitted no later than Wednesday to give us time to review, because if you wait to the last minute to submit, we will not have enough time to review your documents and get you compliant before the final rule sets in March 17th. In addition, those 5 vendors who haven't submitted anything will have to come pick up their billing from the Alta office if they are not compliant, or if they have not submitted anything by the end of the day, March 1st. We are having one more workshop. If you come to a workshop, we make sure that you leave compliant. There'll be no follow-up after that. I'm also holding office hours now every single day for most of my day to help people with compliance and questions they may have. If anyone has questions about their compliance status or needs support with HCBS, please email us to the HCBS inbox, which I am typing into the chat right now. Yeah.
Perfect.
And also on HCBS, we are reviewing all of the grant proposals that were processed today, and we will have word on that by next week to everybody about which grants were selected and what amounts people will have.
And there is a question in the chat, Alicia, in regards to, do we know when community crisis homes, CCHs, right? Those are when they will have to go through the process.
So at this time, there is no plan for CCHs to go through the HCBS process. There's no word from the feds on that. So if there's more additional federal guidance, we will follow up and you will know if you need to turn in paperwork.
Yeah, we'll definitely notify some of our specialized residential providers if they are to have a future requirement. Go ahead, Michelle.
Yeah, I just wanted to share. So Alicia and I, like she shared, we will be reviewing the proposals. And once John gets back, we will be submitting those to DDS. So it might take a little bit more than a week for us to get their responses once they review those proposals.
Thank you. Any other questions on HCBS? Okay, well then what I'm going to do next is, Jason, I'm going to make you a co-host because I know that you're going to be sharing, I think, some slides, right, on our coordinated family services. So let me make you a co-host.
Yes, good morning, everyone. All right, so Michelle helped me put together this really nice PowerPoint presentation on coordinated family supports. So right now I'm going to go ahead and share my screen. Hopefully this works. Okay, are you guys seeing
We are.
PowerPoint? Okay, great. All right, so coordinated family supports. Some of you may be familiar with this new service, others maybe not. So this is a very informative PowerPoint that I'm going to be going over. So coordinated family supports, also known as CFS, is service code 076. And the next slide is the service overview. So for CFS, the service is tailored to the unique needs of the consumer and the family. It provides assistance and training for the consumer and their family in navigating comprehensive services and supports that are tailored to meet their unique needs, which includes creating pathways to overcome barriers and also accessing generic resources and other resources. The service is tailored to respect their primary language as well as their culture. Primarily, this is a service that's provided in the home as well as out in the community. It has some similarities to supported living services. Difference being is that the client lives with their family in the family home. Minimum qualifications for staff and supervisors are set in the service description. And also too, just an FYI for you guys, I'm going to put my email in the chat. So if you guys want a copy of this PowerPoint, you can email me directly and I'll go ahead and send it over to you. I apologize, I forgot to mention that. Community family supports shall not replace or duplicate regional center service coordination, generic resources, or any other regional center funded service. At a minimum, the need for CFS shall be assessed annually with progress reported quarterly. All right. CFS Services, assisting with schedule of service delivery, including medical and other appointments. It also includes identifying transportation options or services, identifying backup providers or supports, and providing those backup direct supports when the plan fails. So CFS can also be used as sort of a last minute resort if one of the original plans for the day follows through. And with CFS, direct support, direct care can be provided. It would just be a matter of making sure that all generic resources are being utilized first. Providing futures planning for the consumer, including those living with aging caregivers. Providing training to the consumer, which maximizes their independence. And coordinating consistency and training across providers specific to the needs of the consumer and their family. Case management referral process. So who is eligible for CFS? It would be clients who are the ages of 18 and older that currently live with a family. There is to be a planning team meeting to determine whether or not the service is appropriate. If so, the service coordinator will authorize 6 to 12 hours for the assessment. The service coordinator completes what's called a referral and service need assessment. And we have the link here on the PowerPoint, which will give you direct access to that assessment. The service coordinator completes the referral part, which is section 1 of that document. And then that gets sent over to the CFS provider. I'm sorry, I'm having trouble speaking today. The CFS provider completes the assessment, which is section 2 of that document. The service coordinator will be required to complete quarterly reviews if CFS services are being utilized. So it is a quarterly tracked service. Now for the service provider process, after a referral for CFS service is made, the CFS provider meets with the individual and the family, and they develop a plan of action, which includes the CFS services that are needed as identified in the assessment that the service provider provided. The referral and assessment tool is returned to the regional center service coordinator who will be determining the authorized amount of hours for this plan of action. When the service is authorized, the CFS provider may begin working with the consumer and their family on the identified plan of action. The CFS provider reports progress quarterly using the reporting tool. And again, there's also a link for that document on this PowerPoint. Consumer family satisfaction feedback. There'll be a flyer with a link and a QR code to complete the online survey, which will be distributed to the consumers within 30 days of starting this service. The flyer will also contain a phone number for those that need assistance with completing the survey. Responses will be submitted directly to DDS to assess the effectiveness of coordinated family supports. All responses are kept confidential, and any future surveys will be sent directly from DDS to the consumer. Informational webinar, if you go onto DDS's website, and also in this PowerPoint as well too, there's additional PowerPoints on CFS. There's also some webinars on here as well too. So we want to, and the webinars are provided. There's one that's provided in English and ASL, and there's also one in Spanish too. And I know that's a lot of information in a quick amount of time. So do we have any questions that come to mind at the moment? I can always, if you have questions that come up later, you can always email me. You know, what I don't know, we can, you know, we're going to be meeting with DDS in the near future as well too, because this is kind of a day-by-day planning with this service. So do we have any questions from anybody at Coffee with Community Services at this time?
Let's see here.
I see Garrett has his hand up. Go ahead, Garrett.
Hey, first of all, thank you for this presentation. Well done. I also, you know, I was listening to the DDS presentation, one of the earlier ones, and I'm hearing sometimes different descriptions of this. You know, one of the descriptions I've been hearing from Alta is that it's like SLS, but it's in the family home. And DDS didn't really address that in the questions during the session that I went to. Because in some sense, it does kind of sound like that. It has the quarterly reporting. It's the default service where they have to jump in if the other services aren't available. But in other ways, it doesn't seem like it. One of the things that DDS was talking about was like that it can be provided simultaneously with ILS. And at least in this catchment, that's at last check, not something we normally do. And it's also compensated at $20 more an hour than the rate study for SLS in this catchment. So I'm curious if you can speak more to the similarities or dissimilarities with the SLS comparison, and if you know like what max hours purchases, what they're looking for max hours purchase. Is it like all of the hours that wouldn't be covered by generic resources and other services, or do you have a sense for it being a lower number of hours after the assessment period?
So I mean, for the total amount of hours per month, I mean, that's going to be based on the planning team meeting decision.
Always.
We would want to, I'm sorry?
I was saying always.
Oh, I'm sorry, Garrett. Yeah, absolutely. We do want to utilize those generic resources first. And also, you know, what I mentioned in the description is that CFS does not replace other services that, possibly vendored services. So, we would utilize those services first before we put in the CFS service. Another big difference between SLS and CFS is that this service is tailored to meet the individual needs of the client and their family based on their language and their culture. So it's a matter of coordinating all their services to address those needs.
Yeah, and I know that it's very exciting, right, when new service corps and supports like this come out. And as we start to learn more too, Garrett, I think we'll have some more additional information for you, because it will be interesting. So right now, DDS has not proposed any maximum amount of hours, it sounds like, then Jason, like, right, in program designs and things, there hasn't been any discussion about a maximum amount of hours that could be provided.
No, it's still up for discussion right now.
Nice.
We don't have a total amount. Thanks, Jordan, for bringing that up.
Yeah,
we
that's
don't have a cap at what the hours
right,
are.
right.
And it looks like we had a question in the chat from Laura. Let's see. So this is Laura, this is a different service than SLS. So with SLS, clients need to be living independently, in an apartment, in a room and board, or, in a house. With this service, the clients actually live with their families in the family home. So the services are provided with the client living with the family.
Okay, thank you for clarifying that for me.
Of course.
And Jordan, I just wanted to add, thank you, Jason. Great job. I wanted to add too that Jason and I are working on the request for proposal right now, so that we can put that on our website. We are looking for vendors at this time who are interested, and just let us know. There is no current deadline that we need the request for proposal on there. Our goal is to get that out on our website by the 1st of March. But if you are interested and you have any additional questions regarding this service, and like Jordan said, and Jason, we are continuing to get information. We have additional meetings with DDS to get some clarification. So if you have additional questions, I always shoot those over to Jason. He will be the lead for the coordinated family supports. But we'll update you hopefully next Coffee with Community Services. Thank you, Jason, for putting your email in the chat. So we'll update next time on the request for proposal, what that looks like. We're also working on a program design for this service at this current time.
And we're also taking letters of interest right now too. So if you are interested in providing this service, you can go onto our website and go under service providers, and then click on become a service provider. And then there's a link as far as submitting a letter of interest.
Excellent. Thank you. That's perfect, Jason.
Of course.
Perfect. Yeah, great job. And it's so exciting when we have something new like this. And as a community, right, we'll all learn together how this new service code will be delivered. It's exciting though. Excited to see what vendors, applicants we have, right, apply for vendorization. So that's really exciting.
Yes. Thank you, guys.
Yeah, absolutely. So if any other questions, if not, we'll move on to Miss Carly with some employment and training different updates. Any questions? And we'll definitely be discussing, right, like Michelle said, we'll be discussing the coordinated family services for many future Coffee with Community Services. So Jason's put his email in there if you guys have any questions in the interim. So then if there's not any other questions, I'll pass the mic, if you will, over to Carly, who has some training resource updates and also will give us some updates on the VMRC and ACRC collaborative.
Thank you, Jordan. So first I'm going to share a flyer that was shared with us by Carol. It's just a really good opportunity. This is a training that is being given for to train the trainers who are interested in training others on how to work with individuals with disabilities who are also victims of crime or traumatic events. I'm going to share this flyer in the chat so everyone can have access to it, but it's really just a great opportunity for anyone who might be interested in getting trained to provide this kind of training to others. Sorry, I thought
That's excellent. Thank you. This is a great resource.
So I will share that in the chat now. All right. And then I'm going to talk a little bit about the ACRC VMRC collaboration. We've talked about it before, so many of you may have heard a bit about it. ACRC and VMRC used some HCBS funds for a workforce initiative. So we are creating a website to assist our vendors in getting DSP employees. It'll be kind of a Indeed type website, but just for DSPs. And it's going to be, it's a very neat website. I'm going to show the website we are designing it after. It's called DSP Ohio is a website that was done. We actually contracted with the web designers who did this website. And so it's going to look very similar to this one. Can you all see my screen? Okay. So this is the DSP Ohio's website. So it kind of gives some information about what types of careers you can have, but the part we're all very excited about is you can search by county. And so we're going to have this same aspect on our website, of course, with California and with the counties that Alta and Valley Mountain Regional Center serve. But just to give you an idea, you can click on one and it takes you to all of the service providers that are hiring in that specific county. It has a spot about the DSP staffing crisis. We have also contracted with Joey Travolta to do some filming. We're going to be having some commercials. We're going to be having some, I think, radio spotlights. We're really going to be putting a huge focus on getting this website attention. Additionally, we are going to be having 2 career expos, one here in our catchment area and one in Valley Mountain Regional Center's catchment area. We do have a draft flyer ready, but it hasn't been approved yet, so I don't want to share it with everyone yet. But I can tell you that the one for the Career Expo for our area is going to be on March 3rd, and it is going to be at, hold on, what is the name of the place? Charles A. Jones Career and Education Center. It's going to be a huge event. I think we're going to have, food vendors. We're going to have, I think at some point there had mentioned of bouncy castles for the kids. I don't know if they decided on that, but there is talk about making this a really huge event. We have a PR team who is assisting us with really making this a really successful event, and the marketing aspect of it to make sure that we're really getting a lot of people in and shedding a lot of light on the workforce crisis that DSPs have and right now. And so we're very excited about that. Once we get that flyer approved, and we'll send it out to everyone. And yeah, we're very, very excited. The website I think we're in the stages of finalizing and approving the website design. So hopefully we'll be able to get that up and running soon. So that's where we are with that.
That is super exciting, that website. I can't wait to see it when it's finalized. And then did you say March 3rd or May 3rd for the expo in our area?
May 3rd. I may have said March, but it's May 3rd.
Okay, May 3rd. So then, right, we'll have opportunity, like Carly said, to get out the flyer to our community and really get that advertised.
I'm sure it'll be soon. They had sent out a draft just a few days ago, and I think we were just there was a couple of changes that I think some people wanted made.
Okay, so, perfect.
I'm sure it won't be long before we're able to share it with everyone.
Right. Yeah. And then once we are able to share that, right, we'll get the address to all of our stakeholders and our vendors. I know I got a private chat saying, where's that address going to be? They definitely want to be there. So we'll get you guys all those details very shortly. very shortly. Thank you, Carly. Those are both very exciting projects that you're working on. And then any questions for Carly on either of those topics? All right. Well, then we can move along. I just wanted to remind folks, I briefly spoke about it last week, but I did want to remind folks that we are going to be having our request for future proposal for this year's Community Resource Development Plan. That is going to be March 7th between 1 and 2 here at the Regional Center. I am entering the link into the website right now. I'll share my screen just momentarily here. Give me un momento for that. I will share my screen. Just wanted to show you guys a little bit, and for some folks that that attended last week, it'll be a little bit of a repeat, but we formally have our RFP posted on the website, right? So you can see all the details that we have here. You'll see here there is a hybrid link. So if you do not want to attend in person, there will be a hybrid option via Avaya. So that link will be there. We also sent this out via chip mail to many of our vendors, but it is here on the website. As I had mentioned last week, we're pitching 2 projects this year that we are excited about. We have an ASL interpreting vendor project that will also incorporate a signing staff pilot registry. Right, that is very new for us. We have never done a signing staff pilot registry. Our Rima, our deaf and hard of hearing community coordinator, will be definitely assisting us and helping with us in some of that expertise. But the goal of the project is to really ensure that the needs of our deaf and hard of hearing clients are being met in all catchment areas, right? As Rima had mentioned last week, there are several resources kind of in Sacramento County, but in more of our outlining counties, Placer, Yolo, Yuba, Sutter, right, El Dorado, that there is a lack of resources, right? That she had done some surveys with stakeholder groups, and that was the data that was received back. Also, as we talked about, right, with Carly's, there is this DSP workforce shortage, right? And for many of our vendor day program and work providers, they do not have a lot of staff potentially, right, that can sign, right? So Rima had the great idea of really looking at a registry piloting project so that we can see if we can start to attract and to recruit individuals that have the capacity to sign, right? They might not be fully certified ASL interpreters, but they have signing skills, right? And so then Rima would work with the vendor who's awarded this project to connect them to vendor day programs and work programs and, of various different programs, right? ILS, different things to help get those people over to the vendors that are in need of the signing staff that have that skill set, really, right? Matching the individuals looking for jobs with the providers who are really in need of that service. So we're excited about that project. We also have, we're going to be doing an adult residential facility level 4I for our forensically involved clients that may be court ordered to participate in a diversion plan. Right? Or maybe they've been found incompetent to stand trial and they're being asked to go through competency training. But in order for them to successfully do that, they're going to need an environment in which they can have supports for sobriety to work through their court-ordered services. So historically, that has been a great need that we've seen with some of our clients with forensic support needs and co-occurring substance use disorders. So we're very excited about this project and hoping that we get some good applicants, right? I'm really excited to provide this additional support to our clients with criminal justice support needs. So I will stop sharing, but does anybody have questions about the RFP that will be heard on March 7th or those 2 projects? You can hear all about them too. I do just want to remind folks that in order to apply for one of the projects, you do have to attend the RFP. Right? Either virtually or in person, but you have to attend in order to be able to apply for the projects. Let's see here. What's next on our agenda? Just a couple of housekeeping reminders. We do have some vendor forums that will be coming up. We have a residential forum on March 16th. Michelle, do you know exactly what time that is? I know our vendors will get the link from Christine Hobbs, but do we know the time on March 16th for that? You're muted, I think, or I can't hear you.
I believe it's 10 to noon, but give me 1 second and I'll verify that.
Okay, perfect. And while she's looking at that, right, so that's March 16th for residential. There's an infant development plan forum that's going to be March 14th. And then we also have an EI vendor forum that's going to be March 21st. And we'll try to get those times in the chats for you. But if you are an EI provider or infant development plan provider, right, then you will also get that invite from Christine Hobbs. But if you have any questions about those vendor forums, let me just put my email in the chat here. You guys can always reach out to me and we can get you additional details if you need that. Any questions on vendor forums? We always like to have our community there, our vendor group. So we'll look forward to those.
Jordan,
Yes, ma'am.
we're also having a meeting with the ICF providers on March the 7th from 10 to 11.
Excellent. And is that remote, Odelia?
It's yes.
Okay,
is.
excellent. Okay, that's great. Thank you for reminding us about that.
Sure.
Jordan, I put the hours. It is 10 to noon for the residential. I put that in the chat.
Excellent. Thank you, guys. Thank you, Odelia. And then, we only have one additional agenda item for today. John knows that John Decker asked us to just ask the stakeholder group here that attended today if any of you guys attended the budget hearings this week. And if so, if you'd like to share your observations or how that went.
I can.
Excellent. Thank you.
It was a very long meeting. It didn't get over with until 9:15 at night. There's a lot of good testimony around the ILS rate fix. There was good representation from the Spanish-speaking population. I think most of them came from the LA region, if I'm not mistaken, but I've never been at a hearing where there was that much input from that population. So whatever advocacy efforts or outreach efforts took place to actually get that population there, it was really well represented. There is a bill, and I'll put it in the chat if we have time before we close, and that is regarding the ILS rate fix for any ILS rate providers that are on the call. There was a lot of concern across the state from families stating that there's a culture of no across the regional centers, that families are having a hard time or finding out that there are lots of services that they should have been offered over many years and not knowing what services are offered, or asking for services and being told no. So that's been talked about quite a bit. So there was other things discussed regarding the rate model, but I think that's all. I think that's pretty much covers it.
Okay. Well, that's great. There was a good turnout, and it's great that our Spanish-speaking clients and families were out there. That's fantastic. We'd love to see them advocating. That's great. Anybody else have anything they'd like to share with the group, either regarding the budget hearings or any other agenda items that the community might have questions about, or that you'd like to see us talk about next week at Coffee with Community Services? You guys are quiet. You're quiet on me. I tell John, I always tease John Decker that he gets people talking more than I do when we cover hosting for him. But if you have no questions, that's perfectly okay. So some additional transportation updates Mary would like to see, so we can definitely talk about additional transportation updates next week. And thank you, Michelle, for sharing the AB 1568 information there for folks. That's excellent. Okay, well, if there's no other agenda items or questions, we will be back to next Friday, right? John Decker will be present, so we'll talk about transportation and a variety of other topics at that time. I did put my email in the chat if you guys have any questions in the interim, but I hope you guys all have a safe weekend. I know that it's going to be storming out there, so stay safe, right? And I hope you all have a really nice weekend. Thank you.
Thank you.
Good job, Jordan, for the 1 minute that I joined.
Oh, John Decker is there. Good job, John.
I'll be on next week, guys. Thank you all.
Mm-hmm.